Hello, my name is John Williams. I'm Chair of Cymru. Priorities for the next Welsh Government. Seamless health and social care. Older people who are medically fit to be discharged often remain in hospital because they don't have a social care package in place that would allow them to return home safely. Many are left waiting in hospital beds while discussions take place between agencies over the funding of a long-term care package. Others are discharged from hospital without sufficient checks to make sure they will be cared for at home, a practice that has increased during the pandemic. This could potentially lead to more serious health issues further down the line and even readmissions. We know that long stays in hospital can have a negative impact on older people. Their conditions can deteriorate, and there's an increased risk of catching hospital-based infections. Lengthy hospital stays can also increase the likelihood of falls and fractures as muscles weaken. There are also problems with long waits for intermediate care or reablement care. Poor leadership and governance, a lack of fund, and logistical problems around sharing information have all been blamed for preventing effective partnership working between the NHS, local government, and the third sector. Older people receiving multiple services would benefit from having a single care coordinator to act as first point of contact, as well as helping to improve coordination between services. The next Welsh Government must ensure that structures are in place so that health and social care services can be seamlessly delivered to older people, that agencies develop effective communication and data sharing to deliver integrated care, that social care is given parity of esteem to the NHS, and that there's a greater focus on providing person-centred care.